Hi guys, and welcome back to BrightWhites. I'm Dr. Brigitte White, and today I'm going to talk to you about sensitivity toothpaste, specifically how they work, and I'm also going to give you a few brands that I think will be useful for you and your family. Before we begin, I have to encourage you to visit a dentist. Make an appointment with your local dentist and just have a checkup. And you want to figure out why your teeth are sensitive and come up with a treatment regimen that will help you treat those specific symptoms. We can't shy away from the fact that dental disease is a cause of tooth discomfort and pain. Whether it's decay or infection or trauma, destruction of the tissues of the tooth will result in pain and discomfort. But aside from that, we can also have tooth sensitivity from grinding our teeth. Studies show that a majority of adults, I think up to 70% of adults, are grinding or clenching their teeth throughout the day or even overnight. And so what happens is when we put so much pressure on our teeth, the ligaments around the root and the supportive tissue become inflamed and uncomfortable, and this often results in sensitivity. So in this case, if you're grinding your teeth, a night guard may be a good remedy. Finally, the most common reason that teeth are sensitive is actually from erosion, and that's caused by the acids in the foods and beverages that we consume that essentially wear away our enamel. So our dental enamel is the strongest tissue in our body. It's rock hard, literally, it's a rock. It's stronger than our bones, it's stronger than our ligaments, our muscles, etc. And it actually cannot be reformed. So if you see a kid chip his tooth, that's it. It will never grow back. Once our teeth start to erode and wear away that protective layer of enamel, the teeth become more sensitive and open for impact from touch, from cold, from heat. And so that's why sensitivity toothpaste aim to actually protect the tooth from those symptoms. When shopping for a sensitivity toothpaste, it's important to look for one of the two following ingredients. The first is potassium nitrate. This is a salt that's added to toothpaste to essentially block the receptors so that they're not triggered by cold, hot, and touch. They're not triggered by those sensations that cause sensitivity. The other ingredient is a type of fluoride called Stannis Fluoride. Similar to sodium fluoride, which is in several toothpastes, it helps remineralize the tooth and strengthen enamel. However, Stannis Fluoride also coats the tooth. It provides like a blanket around our tooth so that it's protected from the impacts of the hot and the cold and the touch. So those are the two active ingredients that you want to look for in sensitivity toothpaste: potassium nitrate and Stannis Fluoride. I want to make a special note about a third ingredient that's found in many toothpastes that actually can irritate our gums and cause more sensitivity, and that is sodium lauryl sulfate. We usually abbreviate it as SLS. Like many sulfates, it's found in cleaning detergents that foam up, like laundry detergent or kitchen cleaners. And essentially this sulfate helps to foam up toothpaste so that it lasts longer in our mouth and helps us keep our teeth clean. However, it has been known to cause soft tissue irritation. And so if you're prone to mouth sores of the like, then you want to make sure that you're looking for a product that does not have sodium lauryl sulfate. And that brings me to the first product that I'm going to recommend, Pronamel, Sensodyne Pronamel. This is the top of the line, the #1 dentist recommended toothpaste for sensitive teeth. It has potassium nitrate, it has sodium fluoride, and it does not have SLS. It doesn't have sulfates. So this product is known to strengthen the enamel that you have left and help keep your teeth free of sensitivity. It's been on the market for decades. I have a good friend, she's used it for years, and studies show that your teeth become desensitized over time. The next product I want to mention is Sensodyne Rapid Relief. This product has Stannis Fluoride, so it coats the tooth to protect it, but it works very, very quickly. For patients that may have burning mouth syndrome or are prone to neuralgias that flare up over time, you should look for the Sensodyne Rapid Relief. Talk to your dentist about this product and see if it can help you with your symptoms. The other product I want to talk to you about is Parodontax, and Parodontax has Stannis Fluoride. The Parodontax is often advertised to fight bleeding gums, and Stannis Fluoride is effective because it neutralizes the plaque and the bacteria that causes the gingivitis or bleeding gums. But at the same time, the Stannis Fluoride provides that protective coat around the tooth to protect it from sensitivity. So there you have 3 products that I recommend. Hopefully this information was helpful. Just to review, when you're looking for sensitivity toothpaste, you want to look for potassium nitrate or Stannis Fluoride. And if you have super sensitive soft tissues, you want to avoid sulfates. Again, you should talk to your dentist or dental team about a product that works for you. Thanks for tuning into BrightWhites. We'll see you next time. Goodbye.